Hello everyone, good afternoon. I'm Dr. Prashanth Kalale. I'm a consultant orthopedic surgeon. I'm based at Apollo Spectra Hospital, Kormangla in Bangalore. I have done my basic medical graduation from JNMC, Belgaum, and also did my master's in orthopedic surgery from Bangalore Medical College in Bangalore. I have been in the National Health Service in the United Kingdom for over a decade and served in many good institutions and also learned higher surgical techniques of the sports injury management in the United Kingdom. I have been back in Bangalore, India for the past 8 years, and I have been associated with Apollo Spectra Hospital since then. Today, we are going to talk about how to manage sports-related knee injuries. In this situation, what I would take for you to understand is first a few ways to understand what is the knee joint, what is the speciality of the knee joint, what are the structures in the knee joint, and how the injuries can happen. When we have a brief idea about it, it becomes more easier for people to understand what exactly is the sports injury and what we expect from it and what will be the outcome of the management. The knee joint is a very complex joint and one of the largest joint in the body. The speciality of humans is that we stand on both legs and walk on the bottom of our feet. The knee joint is meant to do many higher functions. It loads the knee, takes the whole body weight, it bends the knee, it also turns to an extent in the possible direction. In medical terms, we call it a synovial and hinge joint. Synovial is the layer which covers the knee joint and provides the fluid for the knee joint lubrication. The knee, if I may show here, consists of many bones. Essentially, three important bones make the knee joint, which is the femur, which is the thigh bone. Next is the tibia, which is the shin bone. Next will be the patella. The fibula is one of the bone which is associated around the knee but will not contribute directly to the knee joint. The knee is supposed to be very smooth. It has got what we call hyaline cartilage, which is about 8 to 10 millimeters thick. And it also has got good lubrication from the synovial fluid. In between the femur and tibia, we have got what we call the bush, which is called the menisci. This is the higher cartilage, fibrocartilaginous structure, which gives good stability for the knee. It gives a good cushioning of the knee so that it doesn't get injured, or it takes all the load of the knee when it is supposed to take and do the regular action. As I mentioned, knee is one of the largest joints in the body. It is what we call musculoskeletal system because the muscle moves the joint. So the big muscle which is in the knee is called quadriceps muscle, which is in the front of the thigh. Behind the thigh is the hamstring muscle. So this thigh bone is covered with the quadriceps muscle, which comes with the patella, and then the patella goes down into what we call the patellar tendon. The ligaments are there in the knee to give extra support. There is a major ligament which is called anterior cruciate ligament, which helps for the femur to rotate on the tibia and gets the stability of the knee. Behind it is what we call posterior cruciate ligament, which also gives good stability to the knee joint and doesn't allow the tibia to come forward when the knee is bent. Along with that, there are two sets of ligaments in the knee. One on the inside, what we call the medial collateral ligament, and the other one on the outside, what we call the lateral collateral ligament. They give the support to the knee from side to side impact or side to side movement. The last one is the set of bush, what we call the menisci, which is on the inner side, what we call medial meniscus, and the outer side, what we call lateral meniscus. These all together, there is the stability of the knee, which is provided in 3 dimensions: top to bottom, front to back, and side to side. So with all these things together, the knee performs complex movements. The main movement is bending and straightening, what we call flexion and extension. On the top of it, the thigh bone rotates on the shin bone. The femur rotates on the tibia, and the ligament which helps this to happen is called the anterior cruciate ligament. So for normal purpose, if somebody is walking, they need a straight knee. If somebody is sitting, the knee has to be bent. This is the rule. I want to give a brief idea about the amount of force which goes through the knee when somebody is walking or doing their routine activities. If somebody is about 70 kgs in weight, the load on the knee when somebody is walking is 1.5 times their weight. So for a 70 kg person, it's close to about 105 kg, which goes onto the knee for a momentary time before the pattern gets regularized. If somebody is climbing the stairs, then the force onto the knee is almost like 2 to 3 times, almost like 2.5 times their body weight. So if a 70 kg person is walking up the stairs, then the knee is taking a load of about 175 kgs. If the same person does squatting, sitting, or even bend down to tie down your shoelaces, then the force on the knee will go up to 5 to 6 times. So for a 70 kg person, it can go anywhere closer to 250 kg and above. In the context of this, if somebody is running or jogging, the forces onto the knee can go as much as 8 to 10 times, depending on the impact what they're doing. So with this being the normal functioning of the knee, if some injury happens to the knee, the structures which are involved, if they are not working properly, then the function of the knee will get affected. So here in Apollo Spectra Hospital, we specialize in sports injury management, and our dedicated physio team are well-versed with all sorts of sports injury and have very good professional experience and have made a difference to many of the sporting athletes. And I would suggest that if anybody has got any specific sports related injury or any concern, please do contact so that we can try to help you out in the best way possible.